In this video, we will review the Pressure Injury Prevention and Management Program here at Halton Healthcare. We will look at the pressure injury prevention policy that has been developed and based on current best practice guidelines. In this policy review, we will discuss the strategies and tools that are employed to keep our patients safe. A pressure injury has been described by the National Pressure Ulcer Advisory Panel as a localized damage to the skin and underlying soft tissue, usually over a bony prominence, or related to a medical or other device. The injury can present as intact skin or an open ulcer and may be painful. The injury occurs as a result of intense and/or prolonged pressure or pressure in combination with shear. When we examine hospital-acquired pressure injuries, we see that these wounds represent unintentional harm to the patients we care for, and as such, we strive to minimize this harm. It is important to identify that not all pressure injuries are preventable, but most are. There are a small number of patients that will develop pressure injuries even though all the prevention interventions are appropriately implemented. Even in these few occurrences, we still do all we can to support our patients and their families through these challenging times. The Halton Healthcare Pressure Injury Prevention Policy focuses on timely assessment, early intervention, education, and documentation. The prevention of pressure injuries utilizes a prevention cycle that includes assessment, followed by intervention, ending with an evaluation. This cycle repeats as patients continue through their journey in their hospital stay, potentially moving from one unit to another. Our assessment begins with a thorough examination of the skin of all admitted adult patients, with the exception of those maternity and mental health individuals. The purpose of the skin assessment is to identify potential or actual skin breakdown. It is important to complete the skin assessment immediately in the ER, when we transfer between units, and on discharge to another care environment. Our hope is to identify early signs of skin damage, allowing for early intervention that will help prevent actual skin damage from occurring. At Halton Healthcare, we use the Braden Pressure Injury Risk Assessment Score to assess patients' risk. The Braden score is a clinically validated assessment tool that accurately predicts a patient's risk for developing a pressure injury. It's made up of 6 subscales: sensation, or the individual's ability to meaningfully respond to painful stimulus; activity, the degree of physical activity; mobility, the ability to change and control body position; moisture, the degree to which the skin is exposed to moisture; nutrition, what is their usual food intake pattern; and their exposure to shear. The Braden risk assessment is completed at different frequencies depending on the location of the patient. For example, if a patient is found in ICU, their Braden score is completed daily. And this is different from patients on an acute medical or surgical unit, that the assessment is completed Monday, Wednesdays, and Fridays. The assessment is frequently repeated due to the fact that our patients' risk changes as their medical condition changes, allowing us to modify their patient-specific care plans as needed. The Braden Pressure Injury Risk Assessment Score forms the basis for preventative interventions and is the reason why the documentation of the risk assessment and prevention interventions is found in Meditech, and it's found together. We want you to complete the assessment immediately, followed by interventions that will form a patient-specific plan of care. Please ensure that these identified interventions have been initiated. As mentioned at the beginning of this video, hospital-acquired pressure injuries are considered to cause unintentional harm to our patients, and they warrant an incident report. The incident reporting system at Halton Healthcare has recently changed and is now found on each desktop through the RL icon. Once you're in the system, you need to click on the pressure injury logo to access the report to be completed. This new form is not very long. It's comprised of 16 mandatory questions, most of which are all drop down. And there is one area for a brief factual narrative description. It's important to know what the criteria for an incident report is. An incident report is to be completed when a patient develops a stage 2 or greater pressure injury. So this does not include pressure injuries that are brought in from the outside. So if a patient was admitted with a pressure injury, we do not capture that. As well, we do not capture other wound types. So these are just pressure injuries. If a patient develops a skin tear from, let's say, a fall or a blood draw or a dressing removal and it causes a skin tear, we do not capture this in this pressure injury incident report. We want to make sure that when we're putting in a pressure injury report that you're also recording it on and documenting it on the Cardex, letting your nursing colleagues know that it's been done and when it's been done. We do not want to repeat pressure injury incident reports for the same wound. Completing an incident report for a hospital-acquired pressure injury allows the organization to track these occurrences in real time and respond quickly if needed. Halton Healthcare does participate in annual Hill-Rom International Pressure Injury Prevalence Survey each February. And this provides us with a snapshot to allow us to monitor our prevention efforts, as well as to compare or benchmark our organization with others across the country and internationally. And it's important for you to know that these results are shared at the senior team level. You will also see these results come by on your unit, typically around the end of spring, early summer. You'll see that these results shared with your teams. The education of our patients and families is an important factor in pressure injury prevention. We've created a pressure injury education sheet titled Working Together to Prevent Pressure Injuries. And this document is meant to provide a simple, basic information that reviews what a pressure ulcer is, what they can expect from their healthcare team, and what they can do to prevent pressure injuries from occurring. This sheet can be found on FormFast and shared with your patient. We've also created a video that our patients and families can view that describes each team member's involvement in pressure injury prevention. This video can be accessed through our hospital website, as well as internally through connections found in the wound care section. When documenting pressure injuries, it's important for us to document the stages correctly. A stage 1 pressure injury is described as non-blanchable erythema. You have intact skin, you put your finger into it and it does not blanch. You apply pressure and it does not blanch. That erythema remains. That is considered a stage 1. A stage 2 pressure injury is not a full thickness wound. It is partial thickness. If you think of a blister, a serous-filled blister, when that blistered skin comes off, you've still got intact skin underneath. That is a stage 2 pressure injury. A stage 3 pressure injury is a full thickness wound. That goes through the full dermis of the skin into the subcutaneous. So that's into the fat layer beneath, and it does not penetrate down to muscle and bone. When you're down to muscle and bone, you've reached stage 4. A stage 4 pressure ulcer is down to those underlying structures. If you see black eschar or a significant amount of sloughy tissue so you cannot see the wound bed, if you see that, you cannot stage it. That is an unstageable pressure ulcer. You cannot see it, you cannot stage it. The last stage I want to describe is a deep tissue injury. That's similar to a stage 1, but however, it's more than just a non-blanchable erythema. It is a non-blanchable, but it's more darker maroon turning black. So the skin is still intact, but that discoloration is a dark maroon, almost turning black. That is a deep tissue injury. That tells you that there is a deeper tissue that is damaged. You can warn your patient that that wound is going to open up. You're going to have at least a stage 3, if not a stage 4 wound with a deep tissue injury. We have a number of devices that are used in pressure injury management, and that is the management of pressure. We have a number of different beds available to be used on each unit, and we want to make sure that those patients that are scoring, if we're looking at their Braden score, if they're scoring from moderate to high risk, they need to be on a skin bed. Skin beds are tagged. They've got the red skin bags, the skin tag under them, and that is a marker helping you to easily identify the skin bed. In the management of heel ulcers, we have a number of different options. You can use a pillow underneath the lower leg to float the heel. You can use a waffle boot, the air inflated boots that are available in your JIT carts that can be used to offload the heels. You can fold blankets and put them lengthwise underneath the lower leg to make sure that you're offloading the heel completely. Any one of these three methods or these three strategies will offload the heel and will protect the heel. If your patient is wanting to get up into a chair and they are at risk for developing a pressure injury, or they have a pressure injury, we can always ask for an occupational therapist to do a seating assessment to see whether or not there is a specialized cushion that can be used to protect that person. We have available ROHO cushions at each site that can be used to distribute pressure equally over the bony prominence of the bottom when in a seated position. So let's utilize our allied health team when necessary. As I've already mentioned, hospital-acquired pressure injuries represent unintentional harm to our patients. We need to do the best we can to find these patients that are at risk, identify them, put early interventions in place, and prevent these from occurring. We have to assess and act and not react. Let's do all we can to work as a team to prevent these wounds from occurring. Let's work together to prevent pressure injuries.